Are you a cancer patient suffering from neuropathy as a side effect of chemotherapy? Maybe you're just beginning treatment and on the watch for this common side effect. Welcome to the Inspired Vitality Show. I'm Catherine, and in this video, I'm going to talk about what peripheral neuropathy is, what it feels like, some options for the pain, and 3 complications that you should be on the lookout for if you have neuropathy. Peripheral neuropathy can be caused by diabetes or other medical conditions, but I'm looking at it from the lens of neuropathy caused by cancer treatment. If you have neuropathy and have not had cancer, stick around. This information may still be helpful to you. First, let's define peripheral neuropathy. Peripheral refers to away from the center of the body, and neuropathy refers to the many conditions that involve damage to the nervous system. Did you know that more than 100 types of peripheral neuropathy have been identified? Well, most people know that neuropathy often causes weakness, numbness, and pain, usually in the hands and feet. Symptoms vary depending on the type of nerves that are damaged. First, motor nerves control the movement of all muscles under conscious control, such as those used for walking, grasping things, or talking. The sensory nerves transmit information such as the feeling of a light touch, temperature, or the pain from a cut. Then the autonomic nerves control organs to regulate activities that people do not control consciously, such as breathing and digesting food. Most neuropathies affect all 3 types of nerve fibers to varying degrees. Others primarily affect 1 or 2 types. Symptoms are related to the type of nerves affected. The motor nerve damage is most commonly associated with muscle weakness and can include painful cramps. Sensory nerve damage causes various symptoms because sensory nerves have a broad range of functions. Autonomic nerve damage affects the axons in small fiber neuropathies. Common symptoms include excess sweating and heat intolerance. From my personal experience and other cancer patients' input, people with peripheral neuropathy generally describe the pain as stabbing, burning, or tingling, sort of like a pins and needles type of pain. Again, this can affect your hands, feet, or both. I like to describe it as walking on rocks. For me, it affects my feet, so that's where I'm coming from, or at least primarily. My hands are affected to a degree, but mostly my feet. And say, for example, you're walking on landscape rocks. You feel pressure and also some pointy or jagged edges that dig in. And that's what it feels like to me. It can also feel like a tight muscle sometimes, like you have a muscle that is so tight you can't stretch it out. I notice that it can be worse at night, sometimes waking a person during the night. That has happened with me. The range, again, can be from numbness to extreme pain. And not only can that vary from person to person, but I notice for me personally, sometimes I have a little bit of numbness and sometimes it's more painful. There is stumbling and risk of falls because of numbness and weakness can occur in your hands. And then there's pressure. That pressure can happen on the nerves, such as when you wear tight socks. That can be an effect that can just put pressure on those nerves and cause extra pain. So what can help? In my personal experience, I have found acupuncture to be the most helpful for me, as long as I maintain it on a regular basis. For some people, it's not as helpful. Sometimes just putting up my feet for a while is very helpful. Some people find that essential oils work for them. I have tried that when my neuropathy has woken me during the night, and I've used a little bit of peppermint oil, although I'm not an expert on essential oils, so perhaps an expert on essential oils would recommend some other oil. There are over-the-counter pain relievers and prescriptions from doctors that can be tried. I find that wearing really good shoes is helpful for allowing me to go further distances. I find that keeping my feet warm, because I live in Minnesota, we have cold weather, and keeping my feet warm is helpful with that temperature change pain. Some people find that Epsom salt soaks are helpful. And others have reported that pain creams or ointments and creams that are made for muscle and joint pain can be helpful as well. You are going to have to experiment with all these different options because, again, these symptoms and solutions can vary from person to person. So if you have neuropathy pain and you've tried some of these things or tried something different, drop that in the comments. Let me know. Now, the complications from peripheral neuropathy that you should be on the lookout for can include burns and skin trauma. Because you might not feel temperature changes or pain on certain parts of your body that are numb, you are more susceptible to burns. And this, of course, can lead to infection, the second complication. So say, for example, you have neuropathy in your hands and you're chopping something up and you get a cut. You need to be aware of minor injuries so that it does not lead to infection. And then, of course, falls is the last complication. I mentioned before, there's weakness and loss of sensation or numbness, and that can lead to not having balance and falling. And this is particularly concerning with the elderly who already may be experiencing a little bit less balance. Okay, so I've shared with you what peripheral neuropathy is, what it feels like, some options for the pain, and 3 complications that you should be on the lookout for if you have neuropathy. If you have found this information to be helpful, please subscribe to my channel and be sure to click on the bell so you don't miss any upcoming videos. See you soon.